Hello, I'm Dr. Maria Sulindro, integrative anti-aging medicine practicing in Pasadena, California. And today I would like to introduce my guest speaker. And he is Dr. Edward Weiss. Dr. Edward Weiss. Hello, Dr. Edward Weiss.
Hello, hello.
Hello. Dr. Edward Weiss is a physician, graduated from Yale University and Stanford University Hospital for Internal Medicine Specialist. He furthered his study in acupuncture and Chinese traditional medicine in England, also in San Francisco at the American College of Traditional Medicine and Acupuncture. He's one of the world-renowned acupuncture doctor and physician who treat vertigo with healing quality. Dr. Weiss has been invited as an instructor for the Department of Physical Medicine and Rehab at the Stanford University Hospital. And his practice is just right across from the hospital, Stanford Hospital. I would like to say something about our topic today before I would share with Dr. Weiss regarding this subject. So the topic is vertigo. Vertigo is a sensation of feeling off balance. If you have this dizzy spell, you might feel like you are spinning or that the world around you is spinning. So either way, it can be accompanied by dizziness, the feeling like you are moving or spinning creates a problem for focusing with your eyes. Some people will have hearing loss in one ear and it causes balance problems, can be accompanied also with ringing in the ears, sweating, nausea, and sometimes vomiting. Now, if dizziness is the only symptoms, this can also come from other situations, such as problem with the small brain or it's called cerebellum, or due to the stress, due to the phobia, or motion sickness in the ocean or at the air. But today, we only will share with you about vertigo. So, Dr. Weiss, can you possibly tell us what people might like to know about vertigo?
Well,
Yes.
usually if when you have vertigo, it's a limited symptom. It doesn't last too long, and even if those can be very unpleasant, it usually will go away. Sometimes it goes on, and some people have it for a very long time, and then it can really completely screw up your life. But most of the time, it's self-limited and benign. I'll tell you briefly. Some months ago, I woke up and the room was spinning, and I had never had vertigo. I had lots of patients over the years, but I woke up and I had it, and I said, "Oh my gosh, I can't function if I have vertigo." And so I did what probably most people would do, which was I pulled the covers back over my head and went back to sleep. And when I woke up, it was gone.
Oh, wow. Okay.
So that was usually people are not so fortunate, but I was very lucky about that. Anyway,
And that
so
only one time happened to
no,
you?
I've had a little, but that was when it was the worst, and it never happened. It had never happened before, and I was really concerned because there are some. Most of the time, when you have vertigo, it's not a serious problem. It's not a dangerous problem. It's not life-threatening, but occasionally it can be. And when you first have it, you'll be convinced that you have some terrible thing, and I don't know, 90% of the time it will go away, but
Well,
10% it won't. What?
you're
Yes.
very lucky that you can sleep again. Some people wake up and they won't be able to go back to sleep.
Oh no, exactly. If it won't, but it subsided enough, and I went back to sleep, and I said a few prayers, and it was gone.
Wow, okay.
Okay.
That's good. That's good.
It was very good.
Excellent. So can you talk to us about this vertigo or in relation with nowadays, which is the most, talk topic, which is COVID symptoms?
Okay. Well, I think you probably could get vertigo if you had COVID, but I don't think that's that's not a common side effect from COVID. I mean, if it's more common, some other viruses are probably more common, just a flu, it's more common to have a side effect of vertigo, but mostly, that's one thing. Sometimes medication can do it. Sometimes too many aspirin or anti-inflammatory drugs can give it to you. Some other drugs can give it to you. I don't have a list of, but aspirin and ibuprofen can give it to you if you take too much. No, I don't think that there's a lot related to COVID, although occasionally it's related. I think if you presented with dizziness, that would not be the first thing I would think of. Now everybody has got COVID. That's all you think about.
Yes. Over COVID diagnosis here.
Exactly.
So since you are so famous treating this
Right.
vertigo with your technique, what treatment plan do you recommend to your patients?
Well, I am biased in this way. It's like I always say, let me treat you with acupuncture first, because if it works, there's no danger and there's no risk, and it's not very expensive. And when it works, it's really a lot of times it's immediate or quick, minutes or maybe a few hours. But usually if it's going to work, it works immediately. So that's what I tell people to try if they can get acupuncture. I think that they should try that first. There are some medications that help dizziness. I think it's meclizine is the most common one. You can buy that over the counter in a drugstore, and that works for some people, and it's inexpensive and safe. So that's probably what the other thing I would do right away. If it persists and the simple things don't work, then you better go and have a doctor really check you out. But hopefully you don't get that far. Most 90%, probably 95% of people don't get that far. The simple things will take care of it.
Yes, thank you.
Yeah.
What can trigger these conditions, Dr. Weiss?
Okay, well, as I said, sometimes it's a side effect of medication. Sometimes it's an infection in the inner ear. Sometimes it's a lot of emotional stress. Let me think. That's pretty much it. So it's like it can be a viral infection, a toxic reaction, or an emotional stress, or some combination of the above. I suppose also if you had trauma to your head or your ear, that could do it. And if that were the case, that would be emergency, and you better probably go to emergency room and have that checked out seriously. That doesn't happen very often, but when it does, it can be very serious.
So again, when do they need to go to the emergency?
Well, if you had head trauma,
Head trauma.
trauma to your head or trauma to your ear,
Yes.
or something like that. Somebody hit you, or something fell and hit you hard. Then you better get that checked out, because it could have something to do with what's going on in your brain or your inner ear, and it could be life threatening. But most things are not like that. Most things are unpleasant, but not dangerous.
Yeah. So, since vertigo is making you spinning or the room is spinning against you, so I usually tell the patients to just, I think maybe this is automatically, they squat down and lay down.
Well, yes, exactly. Sometimes there's some little tricks that work. Sometimes you stop, you sit down or lie down, but look at your feet. A lot of times looking at your feet will help your balance and help vertigo if it's not too severe. Normally we have three systems for balance in the body. One is in your ear, one is with your eyes, and one is with touch, mostly in your feet. And as you get older, the one in your ear tends to, it's like it wears out. It doesn't work as well. And so if you replace it's like with your eyes by looking at your feet, a lot of times that will help you restore your balance, and it will improve vertigo, and it'll improve those things and make them go away if you're lucky.
So I remember when you mentioned about miclocine,
Yes.
but if it's now being used, it's a scopolamine transderm where you put it behind your
Oh,
ear.
right. Yes.
Yeah.
I've used that, on a ship, when I was, for seasickness, that works very well. It's a time release with a patch that you put behind your ear, and it's
Do they
I
still have
can't,
it?
huh?
Do they still
It's
have
scopolamine.
scopolamine?
It works very well. You can't use it if you use it too much. There's some side effects. You can have some side effects, but if you use it occasionally, it can be very good. That's mostly for people who have it chronically, or more people like who are seasick, or they tend to get seasick and they have to go on a boat for some reason, or you go on a windy road in a car, and so that works really well.
Can a stress or emotional
Absolutely.
cause that? Yeah.
Absolutely. What's the class of being a dizzy broad, you know, but yes, emotional stress can make you dizzy, make you feel dizzy. And if it's really extreme emotion, it can be just as bad as the worst kind you got from a physical injury to your ear. But it doesn't happen very often.
Okay, thank you, Dr. Weiss. If you don't mind, we have a question from the outside. Okay, do you think vertigo will reoccur, or can you stop this permanently?
Well, some of each. Some people, they get vertigo and then they never get it again. And some people get it occasionally. And what I do is I will treat somebody for an acute problem. And then presuming that it works, then I would say, well, let's do it again in a week. And then maybe in a couple of weeks after that. And if you're fine, let's just wait and see what happens. There's some people where it recurs with some frequency, and then I have them come with some, come once a week or once a month, depending on how often they get it and their economics.
Okay, so in average, how many kinds usually they come? Did you say like maybe?
Well, I usually have people come 3 times, and that's because I have to try different things. And then sometimes if it works immediately, then right away. But a lot of times things work a day later. So I need to get feedback on what works and what doesn't work. I say, give me 3 chances. And most of the time I'll do that. Occasionally once is enough, and that's it. And they're fine, and that's the end of it.
Wow. Once is enough.
Occasionally. Most of the time that's not the case. And it's bad for business.
So how long do they stay for your first treatment in the office?
I generally have people here for an hour.
1 hour.
Different acupuncturists have different ways of doing it. The style. Oh, all right. Here, this is a good line. There are 3,000 kinds of acupuncture, and each one is the best. So there's different ways, but the way I do it is I have people pretty much, they're here for an hour, and I'll talk to them for half of the first time. I'll talk to them half the hour, and half the hour I'll put needles in and let them cook. Subsequent treatments, we might talk for 10 or 15 minutes and leave the needles in longer. So that's an average. Everybody's a little bit different.
So I'm pretty sure, since you're expert also in traditional Chinese medicine, so you do also herbology,
moxibustion. Yeah, I do all that stuff. Although I like the acupuncture the best.
Okay.
It's more magical.
So maybe you like this question. How much do you charge the patients for this treatment, so the audience know what kind of?
Okay. Well, as I said, if you go different places, people charge different amounts. But for me, typically the first visit I would charge $190 and subsequently $150. And I almost always I'll see people once a week, a couple of times at the beginning. A lot of acupuncturists charge less, but they'll see you 3 times a week. And so it ends up being as much or more.
Yes, yes.
But that's for me, that's how I do it.
Yes, yes. Okay, thank you. Thank you for sharing. Now, let's continue our conversations. How many kinds of treatments commonly done to stop these vertigo symptoms other than acupuncture?
Okay, well, for chiropractic will work a lot of the time, not all the time, but that's one thing we didn't talk about. Sometimes you can have neck problems that can cause dizziness as well. And chiropractic is especially good for that, but chiropractic can help anyway. And I said there's some medications that help, and for some people they help a lot. And sometimes you treat it as though it's a migraine headache, and that will work. And there's a lot of medicines that are specific for migraines. Anyway, I guess there's some massage techniques and that are also useful. There's Chinese herbs that are useful. There's probably Western herbal medicine that will work too. I'm just not so familiar with them.
So do you do these Apley maneuver?
Okay. Right. So that's the Epley maneuver. I never learned how to do that. I usually, if I needed that, I would go to an ear, nose, and throat doctor to do that. Although it's not difficult and you don't need extensive training, but you need a little training to know how to do it. There's a certain, actually, it's kind of funny that the model of what's going on with dizziness with the Epley maneuver is it's like a child's toy where you have a little ball bearing and you want to maneuver the thing to get the ball bearing in the cat's eye. And so it's like that. So they have you move your head in a certain series of movements, and that there's these things called otolith, which means ear stone, and they roll around and they sometimes get in the wrong place. And if you do this maneuver, then like the ball bearing gets in the cat's eye, or the ear stone gets in the right place, and the vertigo goes away. Sometimes it's as simple as that. Usually, however, it doesn't work as neatly as that. It's like that's a idea, but it isn't exactly true, but it has some value, and it doesn't harm you to do that. I don't know how to do the Epley maneuver, but it's simple. It's like turn to the left, put your head down, and it's a simple series of movements. And you could look that up, I'm sure, online. I never have.
Have you ever sent anyone for that?
I've never sent anybody for that. I usually will see people who've done that and it didn't work, or they did that and it worked, but then the dizziness came back the next day or something like that. And so then I'll do the acupuncture. No, I think if you go to somebody who knows how to do that, I would do that first, because sometimes it can be really dramatic and there's no danger to it. And if you're lucky, that's the end of it.
I see. Okay. So our audience would like to know, can you have a conversation with me, the condition like benign paroxysmal positional vertigo?
Right.
In a little.
Okay, that's, they love to do that, to make complicated names like that. All that's like, what that means, benign means you don't have a terrible disease. Positional means if you move certain positions, it's worse, and certain ones it's better. Paroxysmal means it comes and goes, and vertigo means spinning. That's all it means. But by saying it with those words, it sounds like you know something, but you don't, or you might not.
Well, I guess maybe so that they can send to the insurance company with the.
Well, that's right. It makes the insurance company happy. No, for instance, with me, I still, if I sleep on my right side with my right ear down, after a while, when I get up, I'll have dizziness for 30 seconds. and then it goes away. If I sleep on my left side down, I don't get that. So that's exactly what BPPV is.
Yeah. So
Exactly what that is.
yeah.
So I have that, and it's not a big deal. And I've learned to, and I could even sleep on my right. I prefer to sleep on my right side, but then I have a price to pay.
Is it, can it be the cause, like dehydration?
That probably, I don't think it's caused by dehydration, but that might aggravate it. That might aggravate it. You just want to have more fluid so things can move around more freely and go where they ought to go.
Well, can you talk to me a little bit about this, like the inner ear problem, such as like possible tumor?
Well, okay. I mean, we all have our inner ear. It's a very complicated, it's an interesting system. We have, it's called the semicircular canals, and because they're half circles, and there's fluid in there. And then there's these otoliths, which are like little tiny ball bearings, except they're made out of stone, they're made out of bone. And they roll around, and by gravity, they go down. And then they stimulate, there's little hairs in the inner ear, and that's how we tell, it sends a message that says that's down, that's down, and so that our brain interprets that, and that's how we know what's, which way is up and which way is down. And so for some reason, when you have vertigo, that system gets screwed up. And so the Epley maneuver is to maneuver so that the stones are back in the right place. And that's what's going on. That's what's going on. And I suppose maybe an infection in your ear would affect the way that moves, and maybe trauma to the area. You have bruising or bleeding, or the bones are broken or out of alignment, and so maybe that will make you have dizziness.
Mm-hmm.
Okay.
So when do you think we need to be concerned about this tumor in the inner ear?
Oh, if you have vertigo and it's relentless, it doesn't go away, and it goes, and you try everything, then you go and check it out. You get an MRI, or and there's some bad diseases, but the bad diseases are pretty rare. As I said, unless if you've had major trauma to your head, that would be a different matter. But other than that, from a disease, it happens, but it's rare. And so I would wait, because most benign things are benign and they will go away and you'll live happily ever after. But so if it's really persistent, then you should do it. But I would wait a while, because it's unusual to have a bad disease in your inner ear, but it happens. It does happen. So if you had something and it went on for a month, if you had dizziness all the time, then I would go and have it checked out.
Yes.
Then it's probably not anything serious, but at least I would check it out.
But usually, in your case of patients, after 2 to 3 treatments, they get better. Then it's not that kind. So you don't have.
Exactly. I mean, you could it's like working backwards. If what I do helps, then you don't have a bad disease.
Oh yeah.
Or you had a miracle cure. I don't think, it's like you can't say. Maybe it was a miracle cure, but more likely it wasn't a serious problem in the first place.
So let's answer some of the outside questions from the audience. This is from Artisias. Can the nightly air pressure from CPAP machine cause vertigo?
I suppose it's possible. I've never heard of that happening. I think if your CPAP was adjusted wrong, it's possible, but I would say that's pretty unlikely. You mean if the pressure is not what you're supposed to have, right? Well, there's some pressure in your head, but I think that something's not, it's not adjusted right. The machine isn't adjusted right, if that's the case. I'd say, and I don't think, I've never heard of that, but it's possible. Okay. Yes, thank you. Another one from the same person.
Can you do acupressure for vertigo when you are not having a vertigo episode? Or is it more effective to do it when you are having an attack only?
No, it's not that it's more effective. It's just, it's nice to have some feedback, for me to get some feedback. You say, oh, that's working, it's not working. And so if you don't have it, there is no feedback. And so I can do it, and I will do it, but it's not as satisfying, and it's hard to know if it's doing anything. That's all. That's all. So
Yes.
it's better when you have it, or at least have been having it recently, as opposed to just doing it theoretically.
Okay. So, Dr. Weiss, I think the next question is, I think you have answered it, but if you want to add anything, the question is, what is your initial treatment plan?
Okay, my initial, what I say, let me talk to you a little bit and see what's going on in your life. You know, see, you got a lot of emotional stuff in your life, a lot of economic stress or physical stress, or you got a job that's making you sick or something, or you got or something like this. I talk to people, and then I treat them. And as I said, I ask for 3 treatments, and most of the time people will do that. And I try different things, and if they're better, then that's great. I might do a few more after that, or maybe I don't need to do any more than that. Or if nothing's happened by 3 times, I say, don't waste your time and money.
So you mean
if I treat you,
if nothing happened, or if 3 times is good enough?
If three times might be enough, but say I treat you 3 times and nothing has happened.
Then
don't waste your time and money.
You refer them to a.
Well, it would depend what it is. It would, sometimes they should, sometimes I say you're on your own, or sometimes I'd say you ought to go see this specialist, or you ought to go see this. It depends on the situation.
Yes, but I heard even Stanford University refer their difficult patients to you.
Sometimes, sometimes they do. No, I've been here. I've been in my office for 45 years, just doing acupuncture and related Chinese medicine.
Amazing.
So, and I've treated, the president of the university, and and all the big wigs in Palo Alto, and
yes,
political, people come from all over.
So wow, that's amazing. Okay, and I will always remember, if someone has persistent vertigo, I will send them to you, and please send us your business cards.
Okay. They're in the, let's say it's in the mail. It's already in the mail.
Thank you. Now, Dr. Weiss, usually we have like 30 minutes, and let me see, I think, okay, there is one more if you can have 1 or 2 more. Let's do this.
Sure.
Okay.
That's fine.
My aunt has dizziness 1 time a day, maybe more. She hasn't been diagnosed with vertigo yet, but it has persisted for 1 year now. She has an upcoming MRI. Is there anything advice you have?
No, I think, actually the advice would be, probably it's nothing serious, but I think it's reasonable after a year. It's worth checking it out. I don't know, I'm going to make this number up, but I would say 90% that it's nothing serious, and probably another 9% that it's something serious but fixable, and maybe 1% that it's serious and you're going to still have to do something, something like that. But I made those numbers up, but just to give you a rough idea. So that's all. No, if you had it every day for a year, you ought to check it out. Even though if it were something serious, it probably would have progressed, and it didn't sound like that's the case.
Yeah, thank you so much. And from Victor, any relation between tinnitus and vertigo?
A lot of times, first of all, tinnitus, it's actually
It's ringing in the ear.
No, I know, I understand. The real word is tinnitus, and it's a Latin word, which means ringing in the ears. But it's been misspelled and mispronounced so much for so long that tinnitus is commonly used also, but it's not really but it's tinnitus, not tinnitus. Tinnitus means it's an inflammation, and it's not an inflammation. It's just ringing in the ears. A lot of times people who have tinnitus will also have vertigo. Because they're both the inner ear not working quite right. And it tends to happen with old age or loud noises over a long period of time. But a lot of times it just happens. So there's a correlation, not necessarily not a cause, but there's a correlation.
Mm-hmm. So when you treat them, they both will go away?
Sometimes, although it's not really a joke, but it's sort of a funny thing to say. If you go to an acupuncturist for tinnitus and the acupuncturist says it works all the time, you should leave at that moment, because it's hard to treat, and it sometimes will respond to acupuncture, but nobody has got a way to treat it with, most of the time. It's some of the time it works for that. I would try it because when it works, it's great, but that's actually how you can tell if your acupuncturist is full of it.
You're funny. Okay, so Dr. Weiss, before I close, is there any wisdom words for the audience or take-home message?
Oh no, this is a lot of fun. It's fun to talk about this stuff, and the thing is, most of the time, vertigo, for instance, it's unpleasant, but it's rarely dangerous. It's rarely dangerous, and that's the thing. So if you have it, don't freak out. Don't freak out. But if it goes on for some time, then I would have it checked out. But people tend to worry too, because it really gets your attention. It's an unpleasant feeling, and so people do try to get some help right away. Okay.
Okay.
That's it.
So thank you so much, Dr. Edward Weiss, and who practiced in Palo Alto across from Stanford University Hospital.
Right.
I'm Dr. Maria Solindra, Integrative Anti-Aging Medicine in Pasadena, California. If you like this, please subscribe to this channel and give thumbs up for Dr. Weiss, and also share with your friends and family. Thank you so much, and I'll see you next week. Thank you, Dr. Weiss.
Thank you. Thank you very much. It's a lot of fun.
A lot of fun. Thank you.
Goodbye.
Bye.
Bye.